Hi everyone, good morning. I'm very thankful that Love Yourself and IAS team invites us to introduce the HIV response here in the Philippines. So before we start in terms of the HIV response, as you can see here, is one of the priority programs of Department of Health is the HIV, together with the immunization, the nutrition, mental health, road safety, digital health, and also hypertension and cancer. So these are the 8 priority programs of the Department of Health for this administration. So for the overview, of the HIV epidemic in the Philippines. So as you can see here, the global data trends show that new HIV infections, AIDS-related deaths are already declining. So as you can see here in Asia-Pacific region, where the Philippines belongs, there is a significant factors or percentage, which is 14% in the new HIV infection since 2010, and 51% decrease of percentage change in AIDS-related deaths since 2010. So next is here. So however, the Philippine trends are inversely proportional to the HIV global trends. Alarmingly, in the Philippines, rapid increase the HIV diagnosis or HIV cases and AIDS-related deaths based on the 2023 estimates, which is 418% change in the new HIV infection since 2010 and 538% change in the related deaths since 2010. So, as you can see here, nearly 1,000 deaths among diagnosed HIV were reported by 2022, and as of October 2023, deaths reported already reached 834, and almost half, 49%, came from the YKP or the young key population. The MSM, which is 25 to 34 years old. So although the Philippines still has less than 1% incidence of the HIV per 1,000 uninfected population, the rate of the increase is 438% from 2010 to 2023. And also consider the fastest rate of the HIV cases in the Asia Pacific. Currently, it's noted the country concentrated the HIV epidemic among population base in line with the epidemic in the country. So, in 2023, the current was projected in have 26,700 HIV new infection in 2023. So 89% of that belong in the MSM group or population, while in terms of the group, almost half, which is 47%, is the YKP or the 15 to 24 years old. A reverse trend was noted where 47% of the HIV cases here in the Philippines is 15 to 24 years old, which is the young ones or the young adolescents. We know the HIV epidemic in the country is projected still in the continuous increase in the next years. However, we must not discount the efforts we've made in the past years. If no HIV intervention were implemented since 2005, such as providing life-saving treatment, prevention services, and the number of infection would have reached 442,600 in 2022. But because of the intervention that we've done, the hard work between 2005 to 2002, a total number of cumulative HIV infection have been reduced around 174,700. Therefore, with the collaborative efforts and intervention in place, around 268,200 HIV infection had been averted. Moreover, around 38,700 cumulative AIDS deaths had been averted. So because of this, we want to insert the thanks to all, to the community and also the facility, LGU until community-based organization. Yet, we also acknowledge that there are still more work to be done in the Philippines. Okay, the National HIV Prevention and Control Program. So as you can see here, we have the Philippine National HIV Target, which align with the UN AIDS, the global target for reaching 95% persons living with HIV know their status, and 95% diagnosed persons living with HIV and alive on ART, and 95% enrolled to treatment are virally suppressed to end the related deaths by 2030. So as you can see here, as of October 2023, progress towards the 95, we achieved already the 62, 63, 44, which is 46% viral load testing coverage among persons living with HIV on ART, and 96% suppression among viral load tested. With the collaborative intervention and also efforts in the country, therefore, were gains the HIV care cascade. However, achieving the 95 remains a challenge due to low of testing coverage, low linkage to care, treatment, enrollment among diagnosed PLHIV, and low viral load testing coverage here in the Philippines. So in terms of prevention, as you can see here, we have 3 interventions in terms of prevention. Improving the literacy through the SBCC, or the Social Behavior Communication Change Campaign, the Department of Health Promotion Bureau, or the HPB campaigns target primarily age 18 years old and above, while our partner collaboration focus on the adolescent. In the Health is Life, is campaign focuses on the framework of the strategy of 7 priority agenda of the Department of Health, which is the promoting the sexual health, reproductive health, and also empower the individual availing the related HIV services, including testing, condoms, and lubricants. So in terms of konsulta tayo, involve the individual about HIV, highlight the importance of accessing health services from social hygiene clinic, treatment hubs, and also the community-based organization. And also, for the other intervention, awareness and link services are provided through both digital community level platform. This is a partnership of EPIC, which is free to be you, which raises awareness and accessibility programs about HIV services, quick res in the website, which is the information services, and testing initiation, ART. In terms of the Global Fund, in PSFI, we have Outer Safely app. It looks like in the HIV services. So as you can see here, the Department of Health has priority prevention services. The National HIV Control Program endorses these 3 preventive services. Primary prevention strategies includes mainstreaming the combination prevention of the condoms, lubricants, and also the standard messaging. And also, in terms of secondary preventive services, as you can see here is ranges of the HIV screening, confirmatory, and diagnosed. It is a vital role to include the antiretroviral therapy and make sure that they are retained on treatment. Also included the strategy of infant prophylaxis, from HIV reactive mothers, significantly decreasing chance of the transmission of the HIV exposed infant. For tertiary, preventive strategies here is the diagnosis of management, opportunistic infection, and viral load monitoring to prevent drug resistance. Okay. So in addressing of the challenges of PrEP, we already enrolled 27,297 as of 2023. We already achieved the target of health sector plan, which is 23,000. As you can see, in terms of the awareness of PrEP, we have here the result of the IHBSS, which is 30% only is aware about PrEP and 32% willing to take a PrEP. There's a lot of top reason for not taking PrEP. Feels no risk, afraid of the side effects, and also no time to avail PrEP in the clinics or in the community-based organizations. So in terms of screening and diagnosis, okay, you can see in the screen our diagnosis coverage is age 15 to 24 years old, have 29% for less than 15%. We have 24% which we consider as low. There are reasons as follows: afraid to get tested. As you can see we have afraid for HIV test result, no time, feels no need to get tested. So leveraging the differentiated testing modalities, we need to improve our reach by community-based screening, facility-based screening, the SSNT, the social sexual network testing, and of course, the self-testing. So one of the recent diagnosed cases, advanced HIV disease. Advanced HIV disease is the definition of base clinical criteria of WHO staging 3 and 4 of criteria of immunologic criteria is based on the baseline of the CD4. At the time of diagnosis, moreover, delays in treatment, initiation persists wherein, on average, newly diagnosed clients takes at least 2 weeks before treatment. So as you can see here, there's a lag in terms of treatment initiation and also in terms of the result of the RIVDA or the confirmatory results. So one of the plans of the Department of Health is the RIVDA scale up. Before ROP of 2023, we already have 33 RIVDA confirmatory clinical laboratory all over in the Philippines. As of March 6, we have 85 already confirmatory RIVDA laboratories. So this is a big lift. It's not as an easy encounter challenges along to the due of lack budgetary support, lack of SOPs, documentation, lack of equipment and supplies require additional trainings and low testing. So nevertheless, we remain committed expanding the RIVDA or the CRCL sites. Thus, we continue to advocate the convenes of laboratories to provide such service. To date, we have trained 2,914 laboratory personnel that is equivalent to 1,353 facilities. So, in our immediate goal in the Department of Health now is to establish at least one CRCL or RIVDA per province and one highly urbanized and developed city, while also targeting the high disease burden areas and treatment hubs. So in terms of treatment, we have here from 184 in 2002, we expanded number of the treatment facilities and primary health care to a total of 224 treatment hubs covering all 17 regions to the country. Okay. So as you can see, providing TLD and multi-month dispensing to improve that treatment retention. In the virtue of the offering TLD, as you can see here is we targeted the transition plan, we targeted 80% treatment naive persons living with HIV to be enrolled in TLD. Only 49% were currently on TLD. Only 68% among the new enrollees were stated on the TLD. So, multi-month dispensing is one of the differentiated service delivery models or person-centered approach to retain a persons living with HIV treatment, ensuring their adherence. So in terms of care, so as you can see, viral load testing started in 2019 with 28% coverage among persons living with HIV. However, because of the COVID-19 pandemic restriction in 2020, viral load testing dropped by 11%. With the help of the viral load services and donation of the cartridge by the USAID, we already slowly pick up with the 14% increase testing in 2021 up to current 46% viral load testing coverage as of 2023. So our challenges and concerns in the Department of Health, we have already 3 challenges in terms of prevent, treat, and sustain and care. So, of course, we need to advocate the knowledge or the messages about the correct data and also correct information about HIV, low condom use, stigma including self-stigma in terms of treat is unstable supply of diagnostic, unstable supply of medicine, and multi-month dispensing. Sustain and care is available to the machine cartridge based not optimally used. So I think this is the last slide. So prevent, treat, and sustain care of the Department of Health for the ways forward. Moving forward, the program will implement the following strategies, ways forward, in line with the 7 AIDS medium-term plan, which is the prevent, treat, and sustain and care protect. So every stakeholders and every partners, we need to have lovely vision in terms of this HIV epidemic here in the Philippines. We hope that we tackle the problems of the health sector with sense of shared ownership and safeguarding the health of every Filipinos. And that's all for me. Thank you so much.